Hello, this is Lisa LaRose here on Connect to Love on PRN-FM, and I am so excited for the show today to share with you something so amazing and introduce you to one of the most heart-based dentists that I know. First, I want to welcome Michael J. Russ, and then I will introduce our guest. So welcome, Michael.
Wow, wonderful to be here yet again. It's awesome.
Yeah, and we are so blessed today because we have Dr. Saul Pressner with us. And Saul Pressner is, in my opinion, a pioneer. And he's a maverick. He is truly a very empathetic and skilled dentist. He takes a different approach than most dentists do. He is the president of the Academy of Biomimetic Dentistry, and you're just going to love him. So I'm just going to welcome you, Saul, because there's so much I can say, but we have so much to share. So I want to say a big welcome and a virtual hug because it's so wonderful to have you here.
Absolutely.
Thank you so much, Lisa. Thank you, Michael. Thank you, Lisa, so much for having me. I appreciate it. Thank you.
Yeah, I just want to say, Saul, I've had the pleasure of sitting in your chair, and it's probably one of the highlights of my my experience with dentists in my life, because it was just so different that it just blew me away. And I'd like you just to share with our audience the essence of what you do as a dentist and why you do it.
Thank you, Michael. Sure. And I remember when you were in my chair. Thank you.
Yeah, absolutely.
Thank you. Basically, biomimetic dentistry, which is what I practice, is our philosophy is to do no harm, which is an oath we all take as dentists and as physicians when we graduate from our respective professional schools. But in biomimetic dentistry, we really try to just preserve as much of the healthy tooth as possible, and we take away any diseased tooth structure. And instead of filing a tooth down for a crown, which is what traditional dentistry has taught us when part of the tooth cracks or there's a lot of decay, with biomimetic dentistry, we try to just remove the diseased portion of the tooth and effectively bond to the remaining healthy tooth structure and build the tooth back up. Because peer-reviewed studies tell us now that the more healthy tooth structure we preserve, the more likely it is that tooth is going to survive in the patient's mouth for a longer period of time. So with biomimetic dentistry, we use various techniques to really key in on just removing the diseased part of the tooth and preserving as much of the healthy tooth as we can. We use various techniques to do this, and we use various materials to optimize the health of the tooth, and we try to restore the tooth as closely as we can to what Mother Nature gave us originally. And especially with teeth that have had root canal therapy, biomimetic dental techniques help those teeth last longer, as well as vital teeth. And in biomimetic dentistry, we really try to preserve the vitality of the tooth, and this is accomplished by just removing the diseased portion of the tooth and trying not to expose the pulp, because studies also show that by preserving the pulp, the vitality of a tooth, that tooth is more likely to stay in the mouth for a longer period of time in a healthy way. So that's kind of the essence of it, Michael.
It is. Wow. It definitely is. And that's at odds with, I think, what most of our listeners experience when they go to a dentist. I will simply say, you personally, when we talk about when Lisa mentioned heartfelt dentistry, I got to experience that, and it was so refreshing to be able to sit in your chair, and not only do you have an extremely calm demeanor, but and the essence of you is just full of love and care and kindness. And you also did something that I have never experienced before. You talked your way through the procedure to help the patient understand what you were doing, what what was going to come next. And that's so unique. Is that unique to you, or is that what every biomimetic dentist does?
I can't speak for anyone else. I guess it may be, it's just my style, my personality, because I guess part of my shtick is that I want to communicate with the patient, and knowing that going to the dentist can be an anxiety-producing experience, I feel that to empower the patient with as much knowledge as possible is very important, and part of giving them a sense of control in a situation where they're very vulnerable is explaining to them what's coming next. And I think it kind of takes down the anxiety level a little bit by them knowing what to expect. So I can only speak for myself, but I think that's not part of biomimetic dentistry. It's probably just the way I communicate, and I think and I guess because when I'm a patient, I like to know what's going on too. So I would assume most patients do as well. So anyway,
it's awesome. It is awesome, Lisa. I would tell you, you got to drive down there, Lisa, to experience.
I'm going to fly in. I am already planning on flying there.
However you need.
It's only an hour flight, so it's an easy flight, and and it's so interesting because the methods that a lot of dentists use have been the same methods that have been used for over 100 years, and right. It's so and I don't know what it is about the resistance to want to change. It sort of like gallbladder surgery became like drive-through, like, oh yeah, just get your gallbladder out, rather than address like what the issue is. And the same thing with teeth. Like, we'll just do a root canal, and then they don't address the fact that weakens the tooth. Now, when I was a child, I said to my mom, like, what was with this whole drilling? Because they used to drill the whole tooth out and put this amalgam filling in, and it really did weaken the teeth. And so, I think that I love what is the principle of biomimetic dentistry, which is kinder and gentler, and to return the tooth to its original state. Could you speak a little bit about the method? So if somebody were coming in, like, how does it differ from those 100-year-old methods?
Good question. Well, in certain cases, I don't have to use the drill. I can sometimes just use air abrasion, which is powder under pressure to remove the diseased part of the tooth. So that is less traumatic, both from an emotional standpoint because it's silent, and also it's kinder to the tooth because drilling on a tooth creates microfractures within the surrounding tooth structure. And, unfortunately, with amalgams, which I still have a few in my own mouth, it necessitated the dentist to remove more healthy tooth structure in order for the amalgam restoration to be retained in the tooth. We required retention form, meaning that we weren't able to bond the amalgam to the tooth. We had to kind of push it in, and it was retained by undercutting the walls and creating little mechanical locks so that the amalgam didn't fall out. But over time, with chewing cycles, and if a patient clenched or was a grinder, little microcracks developed in the surrounding tooth structure, and more of the tooth broke off. As a matter of fact, I actually have to go to one of my friends next week because an old filling of mine fell out for that reason, because too much tooth structure was taken away. So today we're able to remove less tooth structure because we have better adhesive techniques, and we rely on adhesion and bonding of our newer materials to the tooth, which doesn't necessitate removing as much healthy tooth structure. So it's much more tooth preserving, and it's better for the tooth long term. And when I was in dental school, we didn't have, it was just at the beginning of adhesion and bonding. But we don't have to rely on mechanical retention to have the restoration retained in the tooth. And what happens is sometimes since we're removing less tooth structure and actually relying upon adhesion and bonding of the restoration to the tooth, over time, sometimes the restoration may need repair. So a lot of times composites, which is what I mainly use, sometimes porcelain, can chip and we can repair it. But the difference is when we do a crown on a tooth with a post and a root canal first, that tooth is much more at risk for catastrophic fracture and failure. So the restoration may survive, but the underlying tooth may not, and the tooth may have to be removed and an implant placed. So it's a different learning paradigm that dentists have to adopt, and it's more about preventing catastrophic failure and preserving the tooth for longer, but realizing that sometimes restorations may have to be repaired, but the bottom line is the tooth is still retained and saved. So the patient is much better off. It's much less costly from a financial standpoint over their lifetime, as well as emotionally and physically. It's much less draining, and it's a more pleasant experience. So things have changed in a positive way in dentistry. And I can only say that at the Academy of Biomimetic Dentistry and through a lot of my mentors in biomimetic dentistry, we're trying to educate dentists in these techniques. It's a slow slog because, like in any profession, people are reluctant to change. There are financial considerations sometimes, but also emotionally, it's hard to change, but I was lucky to be influenced by some great mentors, and it just made more sense to me. So I was an early adopter, I should say. So anyway.
Well, and I'm sure for you as a professional, going into an office where you see people smile and they're excited to see you because they are, it's just a different atmosphere as opposed to like, oh yeah, you got that. If you're empathic, you're receiving all of the dread and fear and anxiety, and I'm sure you would go home and just feel a little wiped out. And it's a consideration because for us, we're only here on the planet for so long, and Michael and I try to inject as much positivity into our day, and I know you do too. So you just look at your beautiful smile and know that's okay. It's so true.
Now you're just buttering him up. Come on now. Now you're just buttering him up. Saul, how did you... I'm interested in if someone was... not that there's a lot of dentists that listen to this show. We do have a lot of people who go to dentists. Everybody does.
Right.
What would you... how many biomimetic dentists are there, like just in the U.S.? Is it a large organization? Is it
Good
something
question.
that's, not so prevalent?
It's not as prevalent as it should be. My dental academy, which is a non-for-profit 501c3 organization, we have about 250 to 300 members. There are other organizations that are teaching institutions, which are for-profit, which also educate dentists in these in more advanced techniques. We kind of serve, since we're a non-for-profit, we're kind of an educational organization for dentists and for the public, and then we kind of feed our dentists knowledge so that they can progress and take more advanced courses from our other mentors who have for-profit dental academies. And, COVID had a big effect on everybody, as we know, and it had an effect on our dental academy. We used to have an annual meeting in person every year prior to COVID, and we no longer have that. We have online webinars. I have one. I'm actually hosting one tomorrow, once a month, where we bring the world leaders in biomimetic dentistry, online for an hour and a half once a month, for a lecture and then Q&A. And then we invite our listener dentists who are from all over the world. We get usually 150 to 200 attendees on these Zoom conferences to take additional training from our scientific advisors. So, for example, tomorrow, the lecturer who is presenting is a wonderful dentist. She's Turkish. She's from Turkey. She's one of the foremost dental researchers in biomimetic dentistry in the world. And she's going to be talking about sustainable biomimetic dentistry tomorrow, because biomimetic dentistry also fits in with the whole idea of lessening our carbon footprint. We're doing less in the way of aggressive dental procedures. We're using more sustainable materials, and there are less visits involved. It's less costly for the patient. So it kind of fits right in with the whole sustainability movement as well. So she's going to be talking about that, as well as certain techniques to restore endodontically treated teeth that have root canals. And she's at the forefront of this dental research. So, and then next month in February, we're having another one of our scientific advisors who's from Japan. And a lot of the materials we use in biomimetic dentistry are Japanese. And the Japanese have great quality control in terms of their materials. And he's going to be talking about repairing biomimetic dentistry restorations when in need of repair. So we have an active, vibrant, continuing education program in the Academy of Biomimetic Dentistry for dentists all over the world. Last month we had a dentist from Egypt, one from Sri Lanka, Vietnam, from the U.S., of course, South America. So we're trying to expand our reach to reach as many dentists as we can to educate them in these techniques. And it's a slow but steady progression. So it's good.
Yeah. It's exciting, though. And we have listeners from Europe. We have listeners from South America. We just got some new listeners from Denmark, which is really exciting. So we want to welcome them, and Canada, and of course the U.S. And it's wonderful that you can connect with. It's a growing profession because it's very encouraging. And Saul, if you wouldn't mind just speaking to and people say, well, it's just a tooth, no big deal, just take it out. But what is, please, because I really believe that, to preserve your health and your organ system, including your teeth, that it's part of out of the body. And in the Chinese meridian system, the teeth are associated with different meridians. So if you wouldn't mind speaking to that, I would really appreciate some insights.
That sounds really cool.
Sure. Good question. In my view, and based upon what I read in the literature and my experience in dentistry, you're much better off retaining your own tooth. Implants don't always work, and they can become food traps. Implants don't mimic the exact contours of the natural tooth that they are replacing with the crowns that are restored over them. So, in my view, it's much better to preserve your healthy tooth, the periodontal structures around your healthy teeth, and you're better off not losing any teeth. I mean, you can function if you've lost certain teeth, but it's much better to be able to chew on a full dentition, and implants are great if there's no other option. Implants really are a treatment of last resort. We have many techniques these days to try to preserve our own teeth, and oral hygiene is so important. Diet is so important in doing this. And there's been, as you probably know, there is a relationship between a healthy oral cavity and your systemic health. So it's very important to see a dentist often for examinations and cleanings, and early detection as with anything else, any other disease entity, is key. So if you go to a dentist on a regular basis and have your teeth examined and cleaned and x-rayed on a regular basis, problems can be treated much more successfully if they are detected early. And, you know, poor oral health has been related to cardiac issues, certain cancers, pancreatic cancers, even dementia, Parkinson's disease. Wow. So you want to really maintain your dentition and the periodontal apparatus in as healthy a state as you can, not just for the health of your teeth and chewing capabilities, which is also related to overall health. Good mastication is very important, but also to prevent certain systemic diseases from occurring. So.
Wow, thank you.
Like everything else in the body, the teeth have a role to play with regard to our overall health and avoiding future problems away from our teeth.
Correct. It's all related. You can't separate the mouth from the rest of the body.
That is very, very true. And if you get an infection in your mouth that's not handled, I'm making an assumption that it doesn't bode well for if gone unattended.
That's absolutely true, Michael. Yeah. It can be very, very negative consequences. So you want to avoid that. Yes.
I would be very interested in hearing how you deal with someone who comes in who has an infection. Antibiotics, I'm sure, are part of your protocol, but maybe they're not. Could you kind of explain?
Well, it depends on the infection, and it depends on the cause of the infection. First of all, if a person comes in with an oral infection, proper diagnosis is key. You want to know what's causing it so that you can treat it effectively. Mm-hmm. Antibiotics certainly have their place because you don't want an infection to progress to sepsis, God forbid. Mm-hmm. But, it's certainly if someone has an oral infection, they should see their dentist promptly so as to intervene quickly to properly diagnose and treat the condition.
Awesome. Is there a point where someone's tooth is actually too far gone?
Yes, absolutely. Yes. Yeah, we can't. There are certain teeth that cannot be saved. Unfortunately, the disease process has progressed to such a degree due to either caries or a fracture that certain teeth cannot be restored. But many teeth, unfortunately, in dentistry today, a lot of times teeth that really can be saved are extracted because it's easier and more predictable in a lot of ways to extract a questionable tooth and place an implant than to attempt to save a questionable tooth. But that's just a generalization that I think sometimes dentists today are too quick to pull the trigger and take a tooth out. But there are certain cases, as we just alluded to, where teeth are too far gone and they have to be extracted for the best, for the health of the patient. It just depends.
That's an interesting point. Lisa, do you have any other? I know we've just covered the tooth in relationship to the entire body. I'm just interested, Saul, in why this. What was it that led you down this path? Particularly, I knew you wanted to be a dentist, but I'm sure you didn't start out.
That's what I was going to ask too.
Biomimetic dentistry. I want to go there. What was it that led you down this path?
Well, I may have mentioned this to you years ago, but forgive me if I'm repeating myself. I went to dental school at the University of Pennsylvania in Philadelphia, for which I'm grateful. It was a great school, and I was fortunate to receive a very fine dental education. And then I did a 2-year family dentistry residency at the University of Connecticut in Farmington, Connecticut, at the dental school there, which was a great program. And it was very different from Penn. We had a lot of Scandinavian faculty, whereas at Penn we had pretty much American faculty and some foreign dentists as well. But it was Penn was great in the sense that our dean at the time, Walter Cohen, was really considered the father of periodontal therapy, and he developed the specialty of periodontics, treating the gums and bone hard tissues and soft tissues. And he was a wonderful man, great guy. But when I went to UConn, I did a 2-year program there, and the Scandinavian faculty, the dean was Harold Lowe from Denmark, who was also a periodontist. And the Scandinavians had a different mindset. They were more conservative and less likely to do bone surgery, whereas a Penn bone and osteosurgery was developed. They did more conservative surgeries to save teeth periodontally. And one of my friends who was a resident with me, who I'm still good friends with, suggested that I take a course with this guy, Ray Bertolotti, who studied in Japan and I'm still in touch with him. We're good friends at this point. He was a ceramic engineer before he became a dentist. And he studied in Japan with this guy, Takao Fujiyama, who developed certain techniques of bonding and adhesion to teeth. And Dr. Bertolotti brought these techniques to the United States. And my friend Bob, who I just referred to, who was a resident with me, said, you should really take a course of this. So I did. And that was key in my education. And I've taken a course with him pretty much every year ever since. And what he said made sense. You want to preserve the healthy part of the tooth and take away the diseased part of the tooth. And to build on that, I started taking courses with a guy named David Alleman, who I'm still in touch with also. These are my two main mentors. He's out of Utah, and he developed adhesion into the discipline of biomimetic dentistry through literature reviews of evidence-based dentistry, basically. And through studying with him, it just made sense to me. It just reinforced Dr. Bertolotti's teachings that you really only have to preserve the healthy part of the tooth and take away the diseased part of the tooth. You only preserve the healthy part of the tooth and just take away the diseased part of the tooth. And doing so is better for the long-term prognosis of that tooth. And it's totally in contradiction to what we learned in dental school. But at the time, that's all that was known. When you broke a tooth, it was taught that you have to file the rest of the tooth down to protect it and do a crown. But that resulted often in doing root canal therapy and posts. And then years down the line, those teeth were lost because they fractured catastrophically. So it just made a lot of sense to me to preserve more of the healthy tooth and just take away the diseased part of the tooth. And it works. And these adhesive techniques and materials have only gotten better as time has gone on. And because of that, we don't have to file away as much of the tooth to retain the restoration. So that's kind of been my path. And through Dr. Alleman and Dr. Bertolotti, I've ended up teaching this stuff too. And just became more and more involved because I believe, talk about heart-based, from my heart. I felt it was the right thing to do for my patients. And it makes me feel better.
That's beautiful.
So that's been my path. So I'm lucky.
It's so interesting, Saul, because Michael and I just did a show about how the universe winks at you and how it aligns different people in your path so that you can do what your soul's purpose was. And to me, to be able to bring something to the world that's kinder and gentler is just amazing. And I love the fact that you I would think that a ceramics engineer would you connect and say, look, I've got a vision to change dentistry. Yeah. I mean, it's amazing to me, really.
Yeah, and I'm still in touch with him. I mean, he's such a good guy. I volunteer in Israel. I did before COVID twice a year at a dental clinic that treats the indigents of Jerusalem of all faiths. We treat Palestinians, we treat Christians, we treat Jews, the impoverished of Jerusalem. Dr. Bertolotti each year makes a donation on my behalf to that clinic. I mean, he's such a good guy because we're trying to do God's work, and try to help the indigents. And actually, I've tried to incorporate biomimetic dental techniques with the clinic director there. So, we're just trying to make the world better, in whatever way however we can. So.
That is awesome. Well, a great mindset, a fantastic therapies. Question, this is kind of off the beaten path, but there's, right now, teeth straightening and all of that is being adopted by regular dentists, I guess, as a way to supplement their income and grow their business. What is your thought about teeth straightening techniques that are going on right now? I mean, obviously, not everybody comes out of the womb with perfect teeth, and there's a lot of pressure on society to look as good as you possibly can. What are your thoughts about that?
Right. Well, it's interesting. I don't know if you're aware, but there was one particular company that just filed for bankruptcy that was doing teeth straightening by just having patients do it themselves at home. And I actually had a patient who did it, and she nearly lost her lower front teeth.
My gosh.
Yeah. So if tooth straightening is done by a capable dentist or orthodontist, I see nothing wrong with it, as long as the patient is made aware of the risks and the benefits, because there are risks, especially in older adults, to moving teeth. I've seen cases where moving teeth in older adults can sometimes cause problems with the remaining teeth. But I think case selection is very important. I think it's a wonderful therapy, and it has a lot of benefits, but you have to choose the right cases. The dentist or orthodontist overseeing the treatment has to be well-trained, and all the risks and benefits have to be laid out to the patient prior to embarking on the course of therapy. From my personal experience, I have always referred tooth movement cases to orthodontists, because I feel that's what they're trained to do, and they would probably do it better than I would. So that's just my comfort zone. So, and I have a very good friend who went to Penn also, who's my go-to orthodontist, who's wonderful, and she will not take on a case if she feels it will not work. She's very ethical, and she does great work. So I think case selection and working with your colleagues is key.
That is awesome. Wow. That is awesome. The other thing I wanted to ask you too, prevention. I know that there are many different types of ways that you can that we've all been told, floss, brush, etc. after meals and things of that nature. Are there any outsized things kind of outside the normal structure of prevention that you've come across, or that they literally talk about in biomimetic dentistry about how to take care of your teeth? Anything supplement-wise, or anything, what to brush your teeth with, maybe what to avoid, that sort of thing?
Okay, I can give you a few techniques, a few tips. First of all, avoid sucking candies at all costs. If you even the ones that are sugarless, except if they contain xylitol. Xylitol has been shown to alter the microflora in the mouth to a more favorable biota that does not form disease-causing plaque. So if you have to use lozenges, use something that contains xylitol. That's number one.
That doesn't contain xylitol?
That does contain xylitol.
Oh, does?
Why it does? Because xylitol is not harmful to the oral flora, and it creates a more favorable oral flora that will not be as likely to cause dental disease. Okay? So if you have to use lozenges, use something that does contain xylitol. Number two, I like flossing and brushing. Flossing once a day, brushing twice a day. I would recommend interdental brushes or picks are fine. Try not to snack between meals. Try to avoid sticky foods, especially in between meals. Snacking in between meals is not a great thing to do, because it offers more of a challenge to your teeth and gums, because the sticky foods that you eat with snacks can cause more sticky plaque formation, which is harder to get rid of, and it attracts more bacteria. So you're more at risk for periodontal disease and decay. So try to limit if you have to have sweets, I don't love eating sugar, but if you have to have a little sugar, I don't advocate sugar, but if you have to have a little bit, have it with your regular 3 meals. And then try to brush and floss afterwards.
That's interesting.
And also, a water pick is a good thing to use. I mean, these are general recommendations. I
got you.
Tailored to each individual patient's needs, but a water pick is a nice adjunct to flossing because after you floss, you loosen the plaque and the food debris, but the water pick actually can help flush out the debris. But try not to use it so on a high pressure. Use it on the lowest pressure. I recommend using it just horizontally. You can put a little antibacterial mouth rinse in with the water, so you get that between the teeth and the gums as well. Those are my main tricks that I advocate.
That's awesome. No.
Okay, here's a question for you. Manual versus electronic toothbrush, like Sonic Care.
I prefer the Braun Oral-B. The Sonic Care is not bad. I think a power toothbrush is good. It's better than a manual toothbrush in terms of removing plaque because most mechanical toothbrushes have a sensor on them to prevent you from pressing too hard.
Yeah.
They have a timer. They're more effective at removing plaque. But, it's more important to floss than the choice of an electric toothbrush. But I think if I had to choose between an electric and a manual, I would choose an electric toothbrush. My preference personally is the Braun Oral-B, but the Sonic Care is also a fine toothbrush.
I've been using Sonic Care for decades. With a soft brush.
I was just going to tell you, the softest bristles you can find. Absolutely. Yep.
Yeah.
And don't press too hard. Don't press too hard with it.
Huh. Okay.
That's a good tip. I know Michael has a beautiful smile too.
Yes, he does.
He does. He does. Beautiful.
There was a little procedure, a little procedure that I think I first went to you for this little procedure because I had a tooth that was in the bottom of my front teeth that was it was progressing backwards, and it was creating a shadow. And instead of, I was too old to have my teeth straightened, but I had him put a face on. What do you call it?
A veneer?
Veneer?
A veneer. He put a veneer on that tooth. That was the first procedure that he actually did, which I thought was really wonderful. I've sat in your seat twice. Once was the veneer, and the other time was I had a filling, an amalgam filling, that you had said, no, we don't need to take that out. You just got a little thing here, and you basically fixed the amalgam filling in a few moments. Didn't require anything. You've never used a drill. You've never used anything to Novocaine or otherwise to.
Remember,
let's talk about that for a second. What is your protocol with regard to use of Novocaine or other kinds of
analgesics?
Analgesics.
Well, I use it if it's needed. But with biomimetic dentistry, we're often doing repairs, and if you use air abrasion, which I think I probably used on you, use air abrasion. It's very gentle, so you don't always need anesthetic. Usually you don't. But if I do use anesthetic, if it's something that is more extensive, I give local, and I use carbocaine, which doesn't have any vasoconstrictor, and it doesn't increase your heart rate. And usually, it's 99% of the time it's effective. So I do use it when I have. Sure. Yeah.
Does biomimetic dentistry incorporate lasers as well, or is it a personal choice by the dentist?
Personal choice by the dentist. I personally don't use a laser, but I have some friends who are biomimetic dentists who do, and it's certainly a credible therapy when done properly. Since I use air abrasion, I haven't found the need to use a laser.
I was going to say, I would think that would be amazing. to use an ear abrasion. Like you said, there's no sound. It's easy and it does what it needs to do.
Yeah, it's less threatening. Yeah, so yeah.
Yeah. I want to mention for our audience, I just want to mention your website, which is newyork-cosmeticdentist.com, and it's newyork-cosmeticdentist.com. So if people are in the area, or if they're like me, they want to fly in to come see you, and so they have a resource. And do you want to give out the website for the Academy? I'm not sure how people might find other dentists in their area.
Yeah, sure. That we have a search engine on the website for that. It's AOB as in boy, M as in Mary, D as in David, .org. AOBMD.org.
Okay, thank you. And I want to say and this is how I know you have a beautiful smile, because I on your website, and you say on there, I love meeting people and developing new long-term relationships. And that's really, this show is called Connect to Love, and it's about meeting those people and connecting, to the heart and really seeing people for who they are. I think in so many industries, it's become so automated. A patient is not, it's so busy, but you connect with the heart. And I did not know that you went to Tel Aviv and to Israel and did that. I'm just curious, is there a story or a person that you met that touched your heart that left you forever changed that you would be willing to share with us? I know I'm putting you on the spot.
From your trip,
you mean
to
Israel or just in general?
Just in general. It could be a patient. It could be somebody that,
I'll give you an example. Sure. The dental clinic that I mentioned to you in Jerusalem, we treat at-risk youth as well. There was this kid, and he was on the spectrum, Asperger's, I believe, and very, very uptight. Only spoke Hebrew. I just speak dental Hebrew.
Well, you have to be able to communicate what you're doing, so that's awesome.
Right, exactly. But the dental assistants, they speak Arabic, they speak English, they speak Hebrew. So anyway, this kid came in. He was about 15 years old, and he broke part of his tooth. He had a very deep cavity on the lower molar. Same tooth as yours, Michael, that I worked on, but his was a lot worse. Yeah.
Oh, yeah.
So, and I had to use anesthesia. I had to use local anesthetic, and I did. And I used a rubber dam. A rubber dam is something we use a lot in biomimetic dentistry, especially if it's a very extensive restoration, because we try to keep the field as dry as possible. It creates like a surgical field. So I used that on him, and they told me, the assistants basically run the clinic, and they told me, you're never going to get this kid numb. It's going to be impossible, but do what you can. So luckily I got him numb, and I used the rubber dam, and I restored his tooth. And afterwards, it's Israel. I was there in the summer, and I already had my scrubs off. I was in my shorts and T-shirt, ready to leave. So the kid runs up to me, gives me a big hug, and he said in English, "Picture." He wanted to take a picture with me. It was so cute, and he hugged me. It was just, and the kid was like bouncing off the walls before I worked on him, but he was very good once he was numb, and he so appreciated the work that I did, and that I was patient with him. It made my day. It made my week when I was there. So that was,
I'm sure.
That was a nice story, and it made it worthwhile. It was nice, so.
Well, I'm sure he felt your calmness and your caring nature, and the fact that you were there to help him. And it's that connection. So many times, we speak a lot about how you never know who it is you're going to meet. That one kind word, or a smile, or just a gentle touch on the shoulder, or lifting somebody's groceries in will make a difference in somebody's life.
You're absolutely right, Lisa, and it's something we all have to be mindful of, and live in the moment, and try to be aware, and try to be helpful. Yeah, thank you. Yeah,
that's excellent. Something we haven't talked about is the fact that one of the things that that we have in common, Dr. Pressner and I, is that we play golf. I talk about golf all the time on the show. And, I would think, honestly, I got to tell you something. At some point in the future, we're going to step out on the
I'd love
course
to.
Together when I can get up that way, because I really, we kind of a simpatico, calm nature, and we love meeting people, and golf will bring that out like in spades. And I know you love to play, and I know you get to maybe once a week or once every couple of weeks, like me, perhaps.
Yeah, exactly.
But it's Is it my first book that I wrote was a golf book, and it was about the mental game of golf.
Really?
And
I didn't know that.
Yeah, It was called Powerful Golf. It was an audiobook. And
wow.
It was. I'll send you a copy. What the heck?
Oh, I love it, Mike. Love it.
Yeah, it was designed to help people play a more balanced game mentally, and it works. It worked on me, and it's worked on a lot of people.
I love it.
But
thank you.
Not to say that you need it, because I know you don't.
No. Believe me, I could use it. It's fine.
I thought you took that calm demeanor from the office out to golf can be that that game.
Oh, I do. No, I do. It's just that I'm pretty calm on the golf course. If I hit a bad shot, I laugh. It's fine. But I love the game. But I could always. This sounds like it's right up my alley. I would love to listen to it. Absolutely.
I think you get a big kick out of it. I'll make sure that I get a copy to your office here this next week.
Thank you.
Yeah, I think you'll love the heck of it. I'm on a golf course, and all I see, I'm out my window right now. I'm watching people chili dip shots all day long. I told my girlfriend, we were outside last week and just enjoying the afternoon sun for a brief moment when it was not 30 degrees, and I saw so many people chili dipping shots, and I looked at her and I said, I think we're going to run out of crackers for all that chili that's being made out there. And she said, I think we need to go to the store because these people need them really badly. It's a little golf joke, but because it's chili dipping. But I look forward to doing that with you. I know that honestly, there are a few like you. And in my own story, that I went down, I found a biomedical dentist 4.5 hours away from me.
Right.
And I went to see her, and she was really nice. She was no Saul Pressner, I will tell you that, but she was very, very good, very polite, very personable, and she upheld all of the mottos of Biomimetic dentistry. She and her office were really wonderful. And they went bent over backwards, actually. Nice.
I'm glad. That's great. Good.
Yeah, and I went to Turkey too. So I this last September, when you mentioned Turkish, dentistry in Turkey is taken is actually really good. Is she?
Yes.
Do you know where she is? Is she in Ankara, Istanbul, or?
No, it's a small. I could get you the name. You know what? I can look it up right now. If you hang on about a minute, I can find it. Hold on one second.
Yeah, I've got somebody over there, and I'd love to when she needs dentistry. Yeah. But anyway.
Let me look it up.
Yeah, you go ahead and look it up. I know, Lisa, that you do nothing more than just enjoy your trip. It'll be one of those pleasant things that you've ever experienced in a quote unquote doctor's office.
And I think for me anyway, it's important. I honor what is my intuition, my inner knowing, and so when in my holistic health practice, I always said to people, I can give you the information, but if it doesn't resonate in make you feel good, then don't listen to me. Do the research, find out what makes sense. And so, when somebody says get this tooth extractor, get this, I had a bonding fall off. And next thing, I have no pain, nothing. And then they're like, well, just get the tooth extracted. Well, that doesn't make any sense to me.
No.
It doesn't resonate with me at all. I'm like, well, that could be your solution, but I would rather invest. To me, it's an investment in my long-term health. And if I go and I come see you and you say, yeah, you know what, maybe that it is best to extract it, then I'll honor that because you're an expert in your field, and I respect that. But I'm just not, you do have to question everything. We're spoon-fed a lot in the media and through just because something's been done for 100 years doesn't mean it's the right way. I mean, exactly. I think there are other things out there, and when you find the wisdom of, I think I have Glenn Brooks to thank for it. He was the one who introduced both Michael and I.
What a loss! Yeah, I know.
Yeah, rest his soul. He was passionate about learning about dentistry. He had such a fear of dentistry, and when he found you, I know you two just hit it off. You made his heart sing, and he just adored you. And I was so blessed to be able to get to know you through him. We had some wonderful conversations together. So I was so excited when you said you were available to join Michael and I, because it truly is a blessing. And, however we can help you spread the word, maybe to some other dentists. We've got to come up with a campaign, Michael, to help get this into more cities.
That's great. And I thank you for carrying on Glenn's work, both of you. It's wonderful.
Yeah,
that was my connection to Saul as well. When we had him on a radio show, I was so blown away. I was in New York I was coming to New York anyway, and with my girlfriend, and I said, I'm going to go stop in on him and see what he can do about this. And then it was like blew me away completely. I know you've got patients that see you, and generations of patients that see you because you are so absolutely amazing with the way that you work with people, and that you love it, and it shows. It shows that you love it. There's nothing worse than sitting you down and see with somebody who's not loving what they do, or maybe their head isn't there in the game, or maybe they're just like a lot of dentists I come across down here. They're into the business of dentistry instead of dentistry.
Yeah, I agree. It's unfortunate for them and for their patients.
It is.
By the way, I found out the professor who's giving a lecture tomorrow, she is from Konya, Turkey. She teaches
Konya. Konya, I know where it is.
I
was there.
University in Konya, Turkey. Konya.
Yeah, K-O-N-Y. Yeah, Konya is a beautiful place. Okay, that sounds cool. I appreciate that. I spent 3 days there in that region. Yeah, it's beautiful. I'll go back in a heartbeat. Well, that's fantastic. Do you have any other questions you want to ask our distinguished guest, Lisa?
We have about let's see, do my math, about 7 minutes left.
7 minutes.
Actually,
right.
I'd love to open it up to you, Saul, because is there something that you feel guided or you'd like to share with our audience that neither Michael and I are hitting on? I'd love to just open it up to you to feel something, if there's something that you would like to share.
I guess I would just thank you both for having me. I am passionate about dentistry. I love what I do. I think since the pandemic, it's been a very hard time for dentists, physicians, and for patients. I've noticed during the pandemic, a lot more people are suffering emotionally and physically. And I'll touch on one thing you said, Lisa, earlier. I think it's very important to get second opinions. Like what you just said about your bonded tooth, the bonding fell off, and someone had said to extract the tooth. It's I would like to pass this on to patients and to your audience. It's so important to get a second, even a third opinion about anything that is going to be done to your body, not just dentistry. I just know of so many cases where patients don't get second opinions and they have procedures done to their peril, and I think it's very important to question. It's very important to get more information, and the internet is not always the Bible. I think it's important. You can do research on the internet, but you have to have it verified by a professional or several professionals who are very credible and who have good credentials, and you get good referrals. But I think it's very important when you're thinking of having a certain procedure done to try to get all your ducks in order and accumulate as much knowledge and go to reputable people. That's what I would like to leave the audience with.
I agree with you 110%, Saul. It's just one of the things that's interesting is that although I know this is not taking off like wildfire, biomimetic dentistry, because, some people get into dentistry, their motivations are financial.
Yep.
And not necessarily for patient's benefit, or for the same reason. It's not a heartfelt decision to become a dentist. And if you're living in a smaller town like I am, it can be an extreme challenge to find someone, and especially find someone to work on your teeth that you can trust. And the other is that dentists come off as authoritative figures, authority figures, and the pressure that that they place on individuals can sometimes usurp that whole, I've got a choice concept, right? Forget about that, because you're sitting in a chair. They're telling you need this now. Because, not because I need to pay my rent, but because you need it now, right? It may not need it now, but you have to sit there and fight that. And with every doctor, it's that way. I've had arguments with doctors because I've simply said, no, I'm not going to do that, or I don't really feel this is in my best interest, and they've taken offense and literally, gotten ticked off at me. It's not your body you're talking about.
It's crazy. Yeah. They take it personally. It's crazy. I know.
Yeah, it doesn't make sense. And so I appreciate the fact that you've said that, and I would urge any of our listeners to I know you were nice enough to take a look at some X-rays that I had a doctor send, and it's nice. It was nice of you to consult with me on that situation.
Sure.
Not saying that everybody should email you their stuff. What I am saying is that if people can find a biomimetic dentist within 4 or 5 hours of where they are, and that's kind of it's worth it. It's worth it to go see a dentist who specializes, who follows this biomimetic dental ethics and mission. It's definitely worth it.
Thank you.
Yeah, and Again, I want to thank you so much. I want to give out your website again, Saul. So it's newyork-cosmeticdentist.com, and again, newyork-cosmeticdentist.com, and it's Dr. Saul Pressner. And do you mind giving out the website for the academy as well one more time, in case somebody didn't catch it earlier?
Sure. A is in Apple, O is in Oscar, B is in boy, M is in Mary, D is in David.org, AOBMD.org.
That's great. Thank you so much. And, Wayne Dyer, who was always one of my heroes, I loved hearing him speak and seeing him in person. He said that passion is a feeling that tells you that it's the right thing to do. And that's exactly what you do, Saul. And I'm so grateful for the time that you generously gave to us today. And I hope that you come back, because it was just so delightful. I always learn something new. Right, Michael?
Absolutely. Always a pleasure.
My pleasure. Thank you. Thanks for having me.
Make it an awesome weekend.
You too, guys.
Absolutely.
Thank you so much.
Awesome. Thank you so much.
Thank you for being on.
Again, my pleasure.